You're listening to Health Professional Radio. My name is Wayne Bucklar and my guest today is Terri Smith. Terri's the CEO of PANDA, and PANDA is the Perinatal Anxiety and Depression Australia. Terri, welcome to Health Professional Radio.
Thank you.
Now, it's a pleasure to have you on board, but I have to say, when I just look at panda.org.au, your website, the domain doesn't instantly tell me what you do, so tell me what it is that PANDA does.
Okay. PANDA's core activity, I guess, is a national helpline. So that's a national helpline running just from Monday to Friday from 10 a.m. till 5 p.m, which is available to families across the country who want to talk at all about an experience of depression or anxiety, either during their pregnancy or through after the birth. So commonly we would talk to families from anywhere from those first couple of months of pregnancy through till, say, a year or so after the birth of their child.
Now, Terri, perinatal anxiety and depression is something I've heard of. Is it common?
Oh, it's very common. I'm going to break it down for you a little bit because it's common, but it's a bit complex as well. So a lot of people are aware of postnatal depression, I guess. So postnatal depression, we've been using that term for a good few decades. We've understood that in that period after the birth, it's not uncommon at all for women in particular to experience a depression, and they're very complex causes of that depression. It's not what people often think of purely a hormonal experience. For some women it is about hormones, but it also can be about a wide range of other factors. So we've talked about postnatal depression quite a bit, and I think a lot of listeners are probably aware of that particular experience. And in fact, it's 1 in 7 new mums are going to experience postnatal depression. So it's a lot. I think if people look around amongst their patient group, or for that matter amongst their friends, they'll be able to think, gee, there's people in my network I may well not have known that was their experience. And certainly in this conversation today, we're hoping to encourage health professionals to think a bit more about the patients in front of them and what might be a disconnect between the information they're presenting and their real life experience. So I'll go through some of those figures. We started with 1 in 7 women in the postnatal period will experience depression. More surprisingly, perhaps, 1 in 10 dads in the postnatal period. So if we'd been talking
really?
12, it's a large number. And if we had been talking 12 months ago, the figure we would have been quoting was 1 in 20. But we have new information out from the Institute of Family Studies now confirming that 1 in 10 experience. And I did say before this is a complex area, and one of the key causes of postnatal depression in men, or a key risk factor, is that their partner is experiencing depression. So it's not uncommon to have an experience where both mum and dad are experiencing postnatal depression. So that's depression and postnatal we've covered off. Anxiety in the postnatal period, both for women and men, is there's not as clear data about anxiety, but we do know that it's at least as common as depression. And really this year there's a big emphasis from our organisation on focusing on anxiety to help people understand that this is as important as depression. It certainly can be as debilitating. And some of the feedback we get from our callers through our national helpline, and I think we've managed close to 50,000 calls now over the last 5 years, so I think we're in a pretty good position to talk about what we're hearing from callers. But often people delay calling because while they've sort of got an awareness of depression, they think, gee, this doesn't feel like depression, and it's because it's not. It's because it's anxiety. So it might be irritation, agitation, even a sense of feeling angry. Some of those heightened feelings. So in depression, where our callers are experiencing a low mood, a flattening, often things are a bit grey. They're having trouble literally getting out of bed or getting on with day-to-day tasks, whereas anxiety, they might still have getting on with those day-to-day tasks, but it comes from quite a different angle. It's really related to an agitation, a heightened mood, if you like, that's not always a positive heightening, of course. So anxiety, just as important. All of that happening with both mums and dads in the postnatal period. But that said, we know that the antenatal period, so during the pregnancy, is also a time where both depression and anxiety can impact significantly. again, on both mums and dads. So anxiety in the antenatal period, we're looking at 1 in 10 mums and probably 1 in 20 dads. So at any level, whether you're looking at the antenatal period, the postnatal period, depression or anxiety, we really have a considerable incidence occurring. And the most important thing we know is that the earlier someone can identify their symptoms, the earlier they can get help, and the better off both mum and dad will be. But also, really importantly, the baby, because of course there's always another person involved in these discussions.
And Terri, you mentioned that the point you're trying to make with clinicians, and that's, as you say, 90% of our audience, and so the take-home message for them today is that the traditional thinking of postnatal depression is not broad enough.
No, that's right. It's much broader, and I think the other really important message is, I know everyone's really busy in their day-to-day consultations, but one of the things we hear constantly from callers to our services, because we'll always say, have you talked to your GP? Is this, have you told your partner? Have you talked to your GP? There are always conversations we're having, and very often we're finding that our callers haven't told those people nearest to them or their primary health professionals that this is what they're feeling. So that, I know part of our core assessment process, we would always, in each and every call, ask someone if they have thought about hurting themselves, if they have thought about hurting their baby. And I think it's easy to assume that someone's doing well because parents are pretty good at putting on that. Often our callers, we hear this term so often, putting on the mask.
Yes.
And by the time you've got your baby cleaned up and ready to go out, and yourself cleaned up and ready to go out, and you're at the GP, and you probably just want to get out of there as quickly as you can. If you have an experience of, not because the GP experience is generally a bad one, but if you've got a story to hide, then it could be that part of your agenda is trying to keep that pretty quick. But all the while, it may well be that they're actually hoping that someone is actually going to ask them how they are actually coping. And of course, it's confused. It's tough. It's hard to distinguish between any mum or dad or new parent is going to report that they've had trouble sleeping. The question is, how much trouble have you had sleeping? In fact, I was having this conversation with a woman the other day, and she was saying, we're talking about, sure, I've had trouble sleeping, but someone had not thought to ask if their baby was having trouble sleeping too. And in fact, her baby was sleeping really well. It was the mum who was having trouble sleeping, which was a sign that things weren't right. Because for most parents, if their baby's getting on and getting off to sleep, well then, there's a celebration there, isn't there? Yay, we better get some sleep ourselves right now. But if it's difficult, and that might be a sign of anxiety. So I think it's just so important for health professionals to have in the background that what's said up front, and we know this from any health condition, but what's being reported might not always be the full story. So that actually inquiring in an open way that allows an answer which says, actually things are falling apart, because sometimes that's what's happening. And in fact, there's great opportunities for early intervention in depression and anxiety in the perinatal period.
Now, Terri, do parents and expecting parents need to get a referral to contact PANDA?
Oh no, absolutely not. As a helpline, it's just a phone call away, so no referral required at all. So it's a good port of first information, as is the website. There's a range of information available on the PANDA website. Sometimes all people need is a little bit of information, and they feel more able to just get on and perhaps have a constructive conversation with their GP. Sometimes, even in the course of our calls, sometimes we're helping people to think about how they're going to frame that conversation. So how will you tell your GP about this call we've had? And certainly we'd be always encouraging callers to our service to report back to their GP and indeed to maternal child health nurses, because or family health nurses they are in some states. So they're also really important players, and we're always reminding our callers that their helpers, their health carers, want to know what's going on in their lives.
And that PANDA website that I think given here is www.panda.org.au.
That's right, thank you. And the helpline number as well,
yes,
if we can go through that. So the PANDA helpline, 1300 726 306. Can I just mention too that if it's dads in particular, we have a separate website which is www.howisdadgoing.com. And that's an opportunity. It's specifically for dads, and it's dads both having their own experience of depression or anxiety, but also for dads to help them help their partner if it's their partner's experience. It's so important to understand. It's a whole family. If someone in the family is impacted at this really crucial time, then it's going to impact on everyone, and it's hard, often really hard for a partner to know how to support either the mum or dad when they're having a tough time. All in the context of the time where a new baby usually is seen as a time that brings great joy. So I think our community, we're still really unwilling to talk about mental illness, but that's even more difficult at a time when there is an expectation that everyone's going to be over the moon because there's a new baby being brought home.
Yeah, and we have got a lot better about talking about mental health and mental illness, but we've got a long way to go, I think.
I absolutely agree. That's borne out every day in our phone calls. And look, it's not uncommon for a mum to tell us that they were reluctant to seek help because they feel that they're a bad parent and perhaps someone's going to take their baby away. And that's for women right across the social spectrum. It's not just for a group of people you might think who've perhaps had some contact with government agencies in the past. It's the nature of depression or anxiety, mental illness in that space that people aren't always being as rational as they might be. So people's ideas can get pretty confused at that time.
Well, Terri, it's been lovely having you on to have a chat with you today. I hope we can do a little bit to spread the word about PANDA. We're unfortunately never going to shake the earth when it comes to media because we're just a little media outlet, but we will have some people listening.
Every step is important, and we always say from our work, each small step makes a difference. So thanks very much for having us on.
Thank you for having us on. And if you've missed my conversation with Terri Smith, CEO of PANDA, Perinatal Anxiety and Depression Australia, then the good news is we have a transcript on our website at www.hpr.fm, and you can also find links there to an audio archive of our chat, which is on both YouTube and SoundCloud. Once again, the website for people interested in getting in touch with PANDA is www.panda.org.au. My name is Wayne Bucklar, and you're listening to Health Professional Radio.